So welcome back once again. Good morning, good afternoon, or good evening, depending on when you are listening to this recording. The topic will be the neglect of children, and it will be in two parts, part one and part two. The reason I put it in two parts is because the recording takes up a lot of space. So it's easier, I think, for you to download. Okay, and so just a reminder, next week your elected official letter is due. So please submit it to me. I will then probably, I believe, email it back to you. So if you want, you can put it under course messages. Okay, if you want, you can put it under course messages. And then the one I email you back is the one you are to use for the elected official. Okay, and again, if anybody has any questions, please call me, email me, etc. Okay. The following week is week 8. I will have to submit midterm grades, so please, please, please make sure all your assignments are submitted because I will submit the grade based on the work you have substituted, okay? If you need to be late for something, please let me know. I will most likely give you permission, although you can't be late for every assignment, and I will ask you to submit it through course messages and not through email, only because I have probably about 95 students and my email will get clogged up, okay? So this is the definition of neglect. Neglect is the chronic failure of a parent or caretaker to provide a child under 18 with basic needs such as food, clothing, shelter, medical care, educational opportunity, protection, and supervision. Just as a little clarification, each state has definitions of neglect and abuse. So this is based on the New York State definition. Also, neglect is often stated as the most often form, excuse me, of child abuse and maltreatment. I don't have statistics on how often, but that is kind of a known fact in the field. And again, statistics change. You know, neglect is often harder to detect. You know, you can see if a child sometimes has been hit or, God forbid, burned with a cigarette or something like that. But chronic neglect is very difficult. So you really have to be kind of trained in that and know some of the signs. And we'll talk about that in this PowerPoint. Okay. So I just thought this was an interesting visual of two brains of 3-year-old children. The one on the left is normal. The one on the right is extreme deprivation. So, it does affect children's brains. We are now finding that some of that can be reversed. Not all. It depends on how young the child was when the neglect or abuse started and how long it also went on. So I thought that this was an interesting visual. So some brain research. Infants of depressed mothers exhibited atypical frontal electrical brain activity. If it was chronic, specifically if it was chronic, went on for a long time, and if it was severe. And chronic and severe neglect can reduce the size of the cerebral cortex. Thus, the child's brain might actually physically be smaller. And again, it depends on how long it went on, how old the child was, were any solutions found early. So stress early in life can promote long-term changes in multiple neurotransmitter systems and brain structures. And often this does not come back for the child. And early stressors, including maternal separation, if children have to go into foster care, or either permanently or on a short-term basis, result in lasting effects on stress-responsive neurobiological systems, and the brain area and learning and memory are affected. So stress response, maybe a simple way to put it is the child could have a short fuse. They get easily frustrated, so they're yelling or they're lashing out or they're hitting. So if you were dealing with such a person maybe in adult life, they would need to learn some techniques about how to deal with stress. And again, actual brain scans of 2 4-year-old children. On the left, a brain that's been stimulated, and on the right, a brain that's been not so stimulated. Okay, so again, you can see they actually can see now the physical effects on the child. And brain activity while performing different tasks. So, on the left, top left, passively viewing words, listening to words, okay, speaking words, generating verbs, okay. So you can see most active, least active. So when you involve a child in something, okay, obviously they develop differently, both physically, emotionally, and mentally. So physical neglect, what is exactly physical neglect? Healthcare refusal, parent doesn't do timely appointments, or delay in seeking health care. They wait till something gets really bad for the child. Abandonment, maybe they keep leaving the child at, an early childhood program late. Custody issues, okay, they often don't, maybe they refuse to hand over the child to the other parent, or they don't pick up the child on time, or they miss their appointments. And inadequate supervision, okay? And again, some of this depends on, when they're looking at, when CPS workers are looking at as a child abuse and neglect, they look at a couple of things. How old is the child? How long the abuse went on. So, you're always looking at age of the child, and you're looking at a pattern. Is there a pattern of abuse? Because the child comes to, school hungry 3 days doesn't mean the child's being neglected, okay? But again, the age of the child is important, because one bad incident could constitute neglect, or sometimes rise to the level of abuse. And then there's, your chapters talk about lots of other physical neglect situations. And then educational neglect, permitting the child to stay home, chronic truancy, even failure to enroll in school. And by the way, in New York State, kindergarten is not mandatory. I know every time I tell that to students, they say, really? I say, yep. So because you didn't send your child to kindergarten does not mean you have neglected your child's education. And inattention to a child's special needs. So what does that mean? That means you don't get the help the child needs, you just keep ignoring, and sometimes even, emotionally neglecting the child by making fun of the child, ridiculing the child. So the next one is emotional neglect. So you see that the child is having some psychological, emotional issues. Maybe you notice them, maybe they get noticed at school, and you either procrastinate in finding help, or you just say, no, I don't believe in that stuff, and you don't take the child anywhere for help. Delay in obtaining psychological care, and inattention to other developmental needs that the child might have. Maybe they're a little delayed in speech, or maybe even in walking. Okay, they're not quite hitting their milestones, and you're not sure why, and then you just ignore it. That's emotional neglect. And then medical and mental health neglect, failure to provide prescribed medical treatment. And again, some of these happen, they usually happen simultaneously, because if you're neglecting a child's developmental needs, obviously, or their medical needs, then they might have psychological and emotional needs. So it's not just clear cut. It's they kind of coexist together. And then immunizations, any surgeries they might need, prescribed medications, or recommended therapeutic or corrective procedures in the case of a serious emotional or behavioral disorder. And then we have non-organic failure to thrive. Okay, non-organic failure to thrive is a condition in which children show a marked sensation of growth. Okay, in other words, they aren't hitting all of their milestones, and an individual has fallen below the 5th percentile in weight and height. So there's non-organic failure to thrive, meaning that the child was once a weight and height within the norm, and they fail to thrive because there's inadequate bonding. And in other words, the child doesn't get enough love and often enough stimulation. And the infant displays a delay in psychomotor development. There's also organic failure to thrive, where there's some physical situation. Now, it can be child neglect if the parent does not take the child to the doctor and get help for it. Or let's say the mother knows that the child keeps throwing up a certain kind of formula, but keeps giving the child that formula. So that would be organic failure to thrive. It's something within the child's system that is making them not grow. And then we have the etiology of neglect. So, what's the high factors that contribute to neglect and abuse to poverty? And it doesn't mean poor people neglect their children more. What that means is poverty causes a lot of stressors, okay? Maybe they don't get a lot of time off from their job. What do they do when their child gets sick? Maybe they need to use food pantries more often. So those are all stressors. Social or ecological influences, okay? Maybe they live in, a neighborhood that's not easily accessible on the bus line. So it takes them longer to get to work and to drop off their child in childcare. Healthcare, they could live in an area where there's inadequate or inaccessible healthcare. Education, maybe the parent or caregiver doesn't have a high level of education, so that influences, they do not know maybe a lot about child development. Child care services, we've heard a lot about child care services during this pandemic, but they're not as plentiful as people think. They have to, there's a cost. If you're low income, your income's low enough, you get part or all of it paid for. But that's not as easy to access. And then for infants, infant care is even less accessible. And then if you live in a rural area, it is even less accessible too. And then mental health services. There is a lack of free mental health services, okay? So again, those are stressors that contribute to neglecting and abusing children. And then, many children, probably over half of children who are abused and neglected are in situations where there's drug and or alcohol misuse, okay? So it's really important, how do you prevent that ahead of time, and then how do you get treatment for that? And then factors affecting the provision of adequate care, okay? We have the family system, strengths, what are the strengths in a family? How big is the family? Who makes up the particular family? Do they have relatives or friends to be able to help them? Strengths, okay, what are the strengths of the family? Do they have resources? Do they even know where the resources are? Okay, income. Obviously, the lower the income, the more stressful it will be. Marital relationship or any other relationships. Do they have anybody to rely on to be able to assist? And the special needs of children. Okay, what are their special needs? Obviously, if there's more special needs, there's going to be more stress in the family. Okay, so that's a very, very quick overview, and your book provided more in depth, and then we will see eventually some videos which will kind of fill in the gaps there. Okay, so this is the end of part 1, and soon the next part will be part 2.